Welcome to Addictions Road to Recovery podcast. I'm very happy today to have Minister Brian Comer, who's in charge of Addiction Services of Nova Scotia Mental Health, and also Dr. Hickcox, Sam Hickcox, who's on the show, who's running new programs that he's instituting with the government. So, gentlemen, I'd like to thank you and welcome you to the show.
Thanks, Carey. Thanks for having us.
Great to be here, Carey.
Well, listen, guys, I've been trying to get you on for a while. I really appreciate it. I know how busy you are. I know how your schedules work and the fantastic work you're doing for the community. As you know, the idea of the show is basically to get your words, what's happening in the world, out to the people who are suffering and their families. And if they have mental illness or they are suffering from addictions, then basically the information may help them to go look for help. So I just want to thank you for coming on the show. I think I'm going to start off by asking you, what are some of the programs available right now, Minister Comer, that can help people that are out there that may be something that people aren't aware of?
Yeah, good question to lead things off, I think. So just a little bit of background on myself.
Sure.
So grew up in Cape Breton as a psychiatric nurse, working in the inpatient kind of hospital setting in Cape Breton most of my professional career. Kind of left frontline nursing to get into politics, believe it or not. So I've been very fortunate since we formed government. The Premier has given me the responsibility to be the first minister for addictions and mental health.
Fantastic.
So I work very closely with Dr. Hickcox, with his clinical expertise, sort of setting up, I would say, innovative and new solutions across the province. So I think a couple initiatives this year that would probably be worth mentioning. I think Dr. Hickcox can probably elaborate on some of the clinical aspects of them.
Sure.
The first acute mental health day hospital is opened up here in Central Zone.
Wow.
Sort of an intensive hospital-based service for folks living with addictions and mental health issues. Which gives
How new is that, if you don't mind me asking? Is it just opened, or is it in the process? Or
Yeah, I believe it was last April, I
Okay.
believe. So this basically gives the opportunity for Nova Scotians to receive, intensive, high-quality care while at the same time returning it home to their families at night.
Yeah.
For example, that's sort of one of the higher acuity, I guess, services we would have introduced. I know we've already discussed the province-wide peer support line, sort of more for the mild to moderate sort of anxiety, depression. People just need to talk to somebody, sort of lower tier supports. And then recently Tranquility, which is a very positive announcement, an online form of ICBT. So I can get maybe Dr. Cox can elaborate what that means to the average Nova Scotian.
Yeah.
But thus far, we've heard very positive things from Nova Scotians, from Yarmouth right to Cape Breton, for uptake with that service. So maybe I'll let Dr. Hickcox kind of jump in to explain what some of those clinical services mean to the average Nova Scotian.
Dr. Sam, be my guest. Like, you are the expert on this area that we really want to bring on with Minister Comer. So please take the show and just tell us what's happening.
Sure, it'd be my pleasure. Yeah, and I just want to sort of say, when we talk about expertise, it's really important. I'm just really, again, as I always have been, struck by and relieved that Minister Comer himself has a significant breadth of clinical experience.
Exactly.
Right? He's worked on the front lines for years, and he recognizes the challenges that are presented to the healthcare system to provide high quality, appropriately timed, equitably accessible mental health care,
Exactly.
right, for all Nova Scotians. And I think having that lived experience, as well as knowing that his motivation really to do this, to do the work as a clinician, and also to enter into politics, is really grounded in caring and compassion, right? So
You can read. I hate to say it, but I can read that on every time we talk or have a little conversation.
Yeah.
He really, you can tell he's been experienced in the field.
Yeah.
He knows how difficult this is, and you're saying the same for yourself. So for me, I just wanted to have you on because I think if people out there are listening, or their family, somebody suffering from mental health or addictions, having somebody like yourself come on and talk about that, and they see you, that you're actually trying to help. That's the biggest thing, that there is help out there if we can just identify it.
Yeah, I think for a lot of folks who are trying to access mental health care, they're in a state of suffering, they're in a state of distress, right? And often it feels like institutions, health systems are these kind of faceless, organizations that don't really hear and understand and respect and care for people. And I do know that every day there are thousands of mental health clinicians across this province, many of who work in the publicly funded system, many of who actually work privately currently, that are actually really, kind of working in an open-hearted way and really working
Yes.
hard to improve access. But there's so much more work that we need to do. So by way of example, there are lots of folks out there who are in a state of distress, are in a state of suffering, and it's not really up to them to be able to discern what's the best care, what are the best services, right? That's
Sure.
where having a system in place that actually helps to direct people to the kind of care they need is really important and really available. So we have a unified, centralized, province-wide intake service that's telephone-based. We're doing some work to really improve access to that service right now,
That's
because
a great idea.
we've come to learn that there's some challenges accessing it. But overall, what it is an opportunity for people to call, have a fairly brief assessment, but thorough enough that the clinicians who are trained and working on the other end of the line can direct people to the services they need.
What we're doing with the show at the end of the show, when this is over, we're going to have a list of all the numbers, including your peer support helpline. We'll be at the end of the show, so we can just stop the video and know where to call throughout the whole province.
That's great.
So well, it's just again getting as much information
That's
as
right.
possible. So please, sorry, continue. I just wanted to pass
That's
it.
okay. So by times, what people would really benefit from are programs that really help them to acquire tools that allow them to optimize their physical health and their mental health and emotional health, right? And so that includes our one of many online internet-based programs that we have available, including Tranquility, which Minister Comer just referenced.
So can you tell me just a little bit about Tranquility, what exactly that
Absolutely.
is, so I can and our audience can see what you're doing?
Yeah, first of all, it was started actually by an individual who themselves had significant disabling social anxiety. It was absolutely crushing them. And they were an individual who had been working in the business world, very high-powered, young kind of upstart, and had been doing really well, but actually was rendered completely incapacitated
Amazing.
and had to leave work. He found some challenges really getting access to mental health help, right, and navigating the system. But was able to get mental health care, and it changed his life. And part of what that process of change did is it inspired him to really take that suffering that he'd experienced, to take the journey that he'd been on, the path that he'd walked, and really put it to good use by creating a new app in conjunction with a number of experts in the field who are focused on an evidence-based, very powerful, well-established form of treatment for anxiety disorders and for depression, and that's called cognitive behavioral therapy. That's what CBT stands for.
Okay.
And this program is referred to as iCBT, and that just really the I just stands for internet-based, right? What we've come to learn, and there's a lot of evidence, like over a decade of evidence, that shows that internet-based cognitive behavioral therapy, which is delivered over the course of typically 10 to 12 weeks, can really impact people's mental health. Those who are particularly suffering from mild to moderate anxiety or depression, right?
Well, see, I think the reason for the show, it's kind of along the same lines you just said, Tranquility. I'm a person who had an addiction, who's recovered, and I have a wonderful life. I want people out there to understand that you can get past this. You can turn your life around. You can do things with the right programs. And there's so many different myriad of different options available that one might be harm reduction, it might be abstinence, whatever works for you. And just knowing the programs are out there and people like yourself are running them. For me, the biggest thing I'm getting from this meeting today is, Minister Comer, you, as Dr. Hickcox said, basically you've done this. So when you're talking to your colleagues, you can give them real numbers of why this should work this way. It's a much bigger advantage for you to walk and say, I was a mental health nurse. So then therefore you understand things. So I think what a combination you guys are. I'm really honored to have you on the show. Thank you very much.
Yeah, thanks for the kind words. I think having firsthand experience is certainly helpful at times. I think also having individuals with lived experience such as yourself is also incredibly important.
Thank you.
Something we've seen as we kind of traveled across the province, which we've been many places, I would say, from hospitals to community-based organizations. Many of the individuals that start up these organizations in the community often have lived experiences themselves, right? So,
Big part of it. You're right.
so I think there's certainly a shift in our thinking at times to really make resources available in the community. I think there will always be a need for intensive hospital-based services, probably, right, to a certain extent.
Yeah.
But we're really trying to increase, access within communities, especially communities that, historically have had difficulty accessing, evidence-based services.
Yeah.
So that's a significant piece of work that's underway now with our office with the Universal Addictions and Mental Health mandate, which essentially kind of, would provide the ability for Nova Scotians, regardless of where they live or their income, to receive high quality care, essentially, right? So
That's the type of thing that your government's doing. Like, I just want to thank you for that, because when people know that they can get that high level of care, even if they're not in a financial situation, because if you have any kind of addiction, I always found you have three problems. You have family, financial, and legal issues. And so if you can address those, it makes your life so much easier. So again, continue on, sir. I just wanted to throw that in there.
yeah, I think addictions and mental health specifically is unique in the sense that it's incredibly complex, right, at times. I mean, sometimes there's issues navigating the system, which I think we can certainly play a role in improving that, for sure. It's something I've seen working in the system myself.
Yeah.
There's also a role that families can certainly play with mental health literacy and reducing stigma within their own, household, to be quite frank, right? So, but I think we've come a long way. I think in the last number of years, in Nova Scotia and Canada, I would say to a certain extent, there's probably still a long way left to go, right? So,
I ran an addiction center 25 years ago, and right now, the amount of money and the amount of expertise going in this field has increased exponentially. And now, after the pandemic, people have realized this is everybody is susceptible to this might happen. And I had a lady on, Kelly Roulette with Nova Scotia Legal Aid, and she said, basically, it's like cancer. It doesn't matter what your financial situation, doesn't matter where you come from, doesn't matter who you are, you can get addicted to something. So the other good thing is that we feel that recovery also doesn't discriminate. So everybody can have access to doing things. And that's our biggest claim. So I think the work you're doing is so fundamentally necessary that I'm really, like I said, I'm just impressed to have you on the show. Thank you very much. Continue on, because you're the experts.
yeah, I'll have a few more comments I may pass over to Dr. Hickcox, but I think looking at mental health needs of Nova Scotians, it's certainly not a mental health silo, right? I think you look at things like housing, you look at things like income.
Sure.
So the provincial government certainly has a role to play with that, but so does our, various governments do, and so does the communities themselves, right?
Exactly.
So we're kind of, consulting with stakeholders across the province, really having meaningful conversations to be partners and to support these ideas.
Sure.
Which I think is a good step forward, for sure. I do think there's some, Nova Scotia is a leader in this in terms of addiction services, along the continuum of care. I think Dr. Hickcox played a large role in developing that model in Nova Scotia, which I think is interesting. So Nova Scotians would have seen the recovery support centers. So once upon a time, they would have been called the inpatient withdrawal management unit centers, or traditionally known as detox, right? So, so the name in itself can often be a barrier in seeking treatment, right?
100%.
Something I've seen from people in Cape Breton, and I know the ability for education now, for group therapy, for referrals to community services if necessary, play a role in this continuum of care. So I think, given that Sam is an addictions medicine specialist, perhaps he can mention a few words about this one.
Be my guest, Sam.
Yeah, definitely will. And just before I do, I just want to just touch on one thing that Minister Comer mentioned, and that's about working with other government departments, other sectors, to really try to address the what are sometimes referred to as the social determinants of health, and what that kind of concept really refers to, or those words refer to, is the idea that one's entire social circumstances really has an impact on your risk of having a significant mental health or addictive disorder, right?
100%.
It actually presents significant opportunities for people if they have a lot of social support, if they're doing well otherwise socially, to really do well and respond well to treatment. And sometimes those other challenges really need to be addressed in order for people's mental health to improve. An example would be those who are unhoused, and living on the streets. who also have a significant mental health issue. Getting those folks into safe, secure, dignified housing is a really important component of their life that's going to really address that's going to really improve their mental health, actually, and provide that foundation for more recovery work to happen. So that's in reference to, like what you had said about family, financial issues, and legal issues being the sort of three ways that in your, experience, addiction has really impacted individuals, yourself included, in the past. So I just want to, I'm just remembering the very first time I ever met Minister Comer, and he'd been the minister for, I think, less than, 3-4 days maybe, and we had our first meeting, and I had been in my job with the government for probably about 45 days at that point, and I was a little bit nervous. New person, never know. Brand new, first minister, really looking forward to it. I'd heard really good things about him. And he asked me, one of the first questions that he asked me, just to set the tone and getting an open-ended conversation going, was, what about the social determinants of health? I think we need to do more. So, I know that, I was really relieved to hear that, because although the formal mental health care system isn't in a position to be able to solve all problems for everybody, all social problems, at least there's a recognition that those are really important to address. And that's part of the work that we're doing, is really trying to coordinate with other government departments and you'll see that in the government mandates coming from our elected officials to all the government departments to really come together to work to support the mental health of Nova Scotia. So I know that that's off topic from where we were going.
No.
I thought it was just really important to emphasize that.
I just want to jump in one place, because I think what looks so wonderful from my eyes as a host of the show is that here's two gentlemen working in the field, both have experience in this thing, and they're able to build these programs, do these services, or to help highlight them. And I think that's what I want to get out to people, that they understand in our community, we have these wonderful people working to do these services. And I think if we can get information out like this, they'll go get help. Okay. I think this show will end up being good for the community. Do you think that this kind of thing is good to get the information out of what services you're providing or aware of?
Yeah, for sure. I think there's a lot of services, whether it's Nova Scotia Health, right? The opiate recovery program is one that comes to mind. Sort of community-based treatment program, right? So, just for one example, it's in all 4 zones. Very positive, I would say, outcomes over the last 10 years in Nova Scotia with opioid use disorder, which is just one example, I think. So,
it's grown. Everything's grown. There's no.
Yeah, so I think this is the clinical sort of modality, with our clinicians in the province that kind of developed that program was a very strong program.
I agree.
Right? So
I agree with that.
So I think you'll see in other, whether it's mental health, whether it's with youth, for example, you'll see, I would say, new and improved ways of accessing care, right? It just generally speaking. With the navigation aspect is certainly something I think we could definitely work with the community on to get that message out there, for sure.
Thank you very much. I appreciate that.
Yeah, I think, so I wanted to kind of get back to this idea of, Minister Comer referenced the notion of a continuum. And what do we mean by that? What we're talking about is that there's a range of different kinds of healthcare services that are either currently available or that we're working hard to make available that will address the particular needs of Nova Scotians based on what level of intensity of formal mental health care they need, or other kinds of services and supports that might even be things that are outside of the formal mental health system. And the analogy I sometimes use is, someone could have like a high blood pressure, right, and maybe some heart problems. Often they will benefit from having their blood pressure controlled and managed through medication, diet, and exercise.
Exactly.
A family doctor is really in a great position, right, to help support that individual. That individual might actually go to the gym, right, themselves. Maybe if they're having some struggles at the gym, or they might be able to recruit the help of a personal trainer, right? So that person isn't a formal mental health professional. They're really actually helping to support that person's
100%.
heart health. On the other hand, some people need to go to the ICU, right? They need to be hospitalized. They need that really specialized kind of more intensive support and care. So if you think of that as along a sort of a spectrum, right?
Exactly.
That same patient may be at times, in the gym, with a family doctor, in the hospital, right? Depending on what their needs are. And that's the way we're really thinking about the mental health and addiction system. So a lot of the innovative work that's really underway right now is trying to really listen to what Nova Scotians need, identify those gaps in service and care and really fill in those gaps. And that's really going to help us with this challenge around navigation.
Exactly. No, that's true.
An example of that are these recovery support centers that Minister Comer had referenced. So 10 years ago, if you wanted to get publicly funded addiction care, the first stop was to get referred and get on a wait list to go to an inpatient hospital-based unit, otherwise known as a detox, right? And lots of barriers to getting there. For example, let's say you're in a crisis and you're seeking services today. You want, I can't take this anymore. I can't do this. I can't keep drinking.
Emergency
I need help.
situation.
Yeah. And the response would be, well, in 2 weeks we'll have you come in, right? And so what we were finding is that lots of people just weren't really able, because of how active their addiction was, to really manage to get themselves to that kind of care. Now, lots of people did, and lots of people really benefit from going to that kind of a program. It's a really important first step in managing that long journey of recovery,
And
which
identifying the
about.
problems
Yeah.
and working with.
So what we've done is taken decades of understanding of what's happening in the brain, what's happening with the body, what's happening with people's hearts and minds who are in the throes of addiction, and saying not everybody needs that kind of a service. What can we do to really improve access? What can we do to really meet those needs? And one component now of our care system that we're standing up and expanding across the whole province are what are called recovery support centers. These are kind of like clinical settings. It looks like it would be a physical space that would have offices and it would even have beds, almost like there'd be a room that would look kind of very homey and comfortable, but a place that people can actually rest. There would be like rooms to do for people to meet in, and what's offered there is medication and medical support through nursing, physicians, and nurse practitioners for people who are going through withdrawal who don't necessarily need to stay overnight.
Yeah.
Right. In addition, there's group work and group therapy there to really support people as they're getting into early recovery, and folks who can really support those folks in finding ways to address those social determinants and really help each individual build their own recovery plan as they go forward. That kind of a program, you can just literally walk in and get going with treatment rather than have to call and wait and so on. Some of those people need to go up into that inpatient setting.
Sure.
And so we haven't gotten rid of the inpatient programs, right? Just like some people need an ICU, but not everybody does.
I'm just going to throw this in
Yeah,
because
go for
I
it.
think this would be close to what you're talking. When I had an addiction problem, and like I said, what happened was we opened after I recovered or started to recover, we opened an addiction center called the Douglas Murphy Outreach Center, named after my dad. And basically what we found was the biggest problem I had, when you stopped any addiction, there's hours and hours you spent on doing that. And that now those hours are free and you're not sure what to do with yourself. So at that point in time, what we decided was we'd open the Douglas Murphy Outreach Center just to have a place where people could come sit, talk. So what you're talking about is exactly what we were trying to do. But back then, there was only 8 beds in the whole province and it's all addictions. Now you're getting more of that. But this idea to me is exactly what we were trying to do 25 years ago, but we didn't have the funding or the things to do it. So I just want to take my hat off to you, gentlemen, because that's a fantastic idea. Sorry, I didn't mean to interrupt you.
So we're really thinking about a lot of like how we're structurally organizing and going to be delivering mental health care and addiction care in that way, right? That so that we're going to make it. We're really taking into account what's happening to people to really create structures and ways of doing business that really make it easier rather than harder for people to actually get the care they need. The Mental Health Day Hospital that Minister Comer referenced is another great example. We're not closing inpatient psychiatric beds.
No.
But what we're saying is that there are some people who they're unwell enough that the only place right now, or historically has been up until last April, has been to go to an inpatient psychiatric unit, which are, there's a lot of pressure on those units, right?
Sure
They're
is.
always full.
Sure
And so this a day hospital program is designed for people who need more intensive supports than, say, what they would get if they went to a clinic, right? But they wouldn't stay overnight. And with much less staff and actually in a very cost-effective way, we've been able to really expand the number of people that are normally would need to go to an inpatient unit and really give them the care they need, often in the community that they're actually living in, so they can go home at night and get family supports. It's an
Fantastic.
environment
No,
that
that's
allows people to
great
recruit
idea.
family into the treatment.
Great
And it's
idea.
actually, we've been able to really improve the wait times to get into the inpatient units as a result of that model. So what we did is we stood this up. We're measuring it. We're doing something innovative and new. Is this actually working? Is it helping? We're tweaking it, and it's going so well that now we're going to invest in it and expand it across the province. And that's kind of how we're trying to do business.
Gentlemen, I got to tell you, this is the thing that I want to get out to people so they know you are doing things. There's work being done. Continue, Mr. Comer, Minister Comer, if you wouldn't mind. Just some things you'd like to kind of just address too, so you two can talk together and just give the people out there an idea.
Sure, yeah. It's I'd say there's a lot going on, certainly within the department. We spent a lot of time over the last year traveling across the province. Just before Christmas, we were down in Yarmouth, Digby, that sort of section of the province. Obviously I know Cape Breton's concerned as well. So all 4 zones have been kind of well heard, I would say,
Sure.
and well respected. Some concerns are very similar, and some are quite unique to the region, I would say. So that's something I would say is a very active discussions within the department now, is really tailoring our programs to each region, for sure. And there's a lot of great clinicians doing great work right across the province, I think. So, it can be very difficult some days to work in healthcare, especially right now in the climate in our province.
Sure.
Just in primary care as well as addictions, mental health care. So,
And the pandemic's made such a difference in everything. I mean, the last 3 years have been difficult for a lot of people. So, that's made your job that much harder, I'm sure.
yeah, so I guess the point I'm kind of getting to is the mental health of our clinicians, right, and our frontline staff is something certainly that I've talked a lot about. That we'll certainly be supporting them in the coming months as well. So
Fantastic.
it's been a long haul, right? You think of the COVID, and you think of natural disasters, and even the invasion in Ukraine. Right?
100%.
There's significant negative media, right, day in, day out. So it really wears on folks in Nova Scotia for sure. So I do think in the coming months we do have a budget coming up, which is a very exciting time, certainly for myself and the department. Can't really speak too much to the specifics of that today. But
We'll have you back on, don't worry.
yeah, I'm sure we'd be happy to come back on after the budget.
Absolutely.
So I do think Nova Scotians will see some very innovative ideas in there and suggestions and things that will be implemented to help Nova Scotians access care differently.
I appreciate it. And I think the other thing I'll say to you, right now, when I was doing this 25 years ago, there was only so many things that people could become addicted to based on certain things. We've opened those doors up to such a large extent that right now, if you watch hockey, football, baseball, any sport, it goes right directly to betting odds. And it's bam. Now, if only 97% can do that without a problem, but the other 3% doesn't seem like very much, but in Canada, that's 300,000 people. So what we're trying to say is, okay, how can we address that? So somebody who's young is going through, and they're spending $100 right now on this, but then they find it's progressing to $200, $400, $600. At that point in time, I just want to have a show where people can look on that and say, well, maybe there's somebody I can call and just to make sure I'm okay. Not that I've got a problem, but just make sure I'm okay. That's the first step I'm trying to do with the show, to get people to just identify there might be an issue, there might not be, and that's where your clinician status comes in, and your background in mental health. That's the kind of thing we want to get out there, so we can just one person just to pick up that phone and say, hey, I'm just curious. So.
Yeah, I think Sam can maybe jump in after me here, but I think when you talk about supports, I think the Gambling Support Network is probably a good place to start, right? So I know provincially too, we do have a suite of services on the MHA, I guess, Mental Health and Addictions website.
Yeah.
Specifically ranging from, mental health care to gambling support and those sorts of things. We certainly would be happy to pass along that information.
Please do. Like I said, we'll
yeah.
post it on the end of the show, so we'll be able to get that out to people.
Yeah, I'm not sure if Sam has any comments with the addictions aspect, I guess, with gambling, but I'm sure he has.
That's
some
just one
thoughts.
component.
Yeah.
We're the show's for all addictions, but
Yeah.
the gambling is just so prevalent right now, more than it's been in the past.
Yeah, it's really striking, right? Where you see now like the advertising that's happening actually, and and we can't ban it. We can't
No.
we can't make it completely illegal. That's really not even technically feasible, right?
No.
And what we found is actually if we regard like the behaviors that people who have addictions are kind of engaged in, right? Like either using what are currently illegal drugs, or even using alcohol and cannabis in ways that are kind of potentially harmful to them or to their community or others around them. And the same goes for gambling. That we have to really regard these as health problems, right? And so what we're trying to do is to really employ what we know, what the science of health care is telling us in terms of what the scientific literature is saying are the best approaches to really helping folks with addiction. So sometimes there's this sort of debate that people have in their minds about something called harm reduction versus treatment. And I think what's important to know is that really, we're just interested in high quality care, the delivery of high quality care that's really grounded in evidence. And so there are some initiatives, interventions, and strategies that for some individuals, some patients, are really effective and really appropriate.
Sure.
And in fact, the potential drawbacks are outweighed by the benefits that. And some of those are what are called harm reduction interventions. Like even Minister Comer had referenced these opioid recovery programs. We know that the gold standard for really helping the health of people who are living with an opiate addiction is to prescribe medications, which in and of themselves are opioids, right? Methadone and Suboxone, and there are some others as well. When these were first introduced in healthcare in 1960, actually in Vancouver, was the first place that ever had a methadone clinic. These were considered just to be purely harm reduction kind of approaches, right? Is methadone right for everybody who has an opioid addiction? No, right? But maybe other strategies are important, right? So in fact,
incorporating them all together.
That's right.
Yeah, no,
that's
I'm
right.
with
So
you.
12-step programming is really good for some people. Having the goal of abstinence from a substance or substances is really a great goal for a lot of folks, right? For some people, other kinds of goals and approaches are really appropriate to improve their health, right? And that's what's important when we think about things like gambling as well. What can we do? What policies and procedures can we put in place? What supports can we put in place so that people can actually, as you had pointed out, early on recognize that they may have a problem and where to go to really, if they're curious and questioning, where to go. I think one of the most significant things that we're going to be working on is to really empower peers and organizations that have a lot of peers in
That goes along with your new health one.
disposal.
Would you mind talk a little bit about that if you wouldn't mind?
Sure. So if you think about that person you're talking about who is asking themselves, maybe I have a gambling problem, maybe I don't. Maybe they feel a bit ashamed about it.
Sure.
They feel embarrassed. They don't want to talk to people around them. Maybe they're afraid, right, that they'll be kicked out of their house by their parents. If
Lose their job, what have you.
lose their
Yeah.
job, right?
Yeah.
Those are real, very real fears. And so being able to call and talk to someone who has themselves a lived experience of addiction could really just be a safe person, right, for them to really have that conversation.
Fantastic idea.
Yeah.
Seriously.
I think that one of the most devastating outcomes of untreated significant mental health or mental illness and addictions is the way in which these disorders disconnect people from society, right?
Exactly.
People become quite often more and more isolated.
Yeah.
And
with the pandemic, it was even worse.
That's
Yeah,
right.
Yeah, no, it's
So I think the stressors of the pandemic really highlighted how isolation really has a profound impact on our health. But it taught us a really important lesson, and it provides us with an opportunity. Any work that we do in the mental health system, any new programs that we have that inspire people to actually be more connected, to look after themselves and also look after others in their community, to take their own suffering and their own pain and use that experience to reach out and actually connect with others as a peer supporter, for example, is really going to help everybody. And and that's what we've come to learn. So a lot of folks really feel safe talking to their kin, right?
No, that's the
First
best
and
point you can make
foremost.
right there.
Yeah.
That person will be a little more relaxed knowing that person has
Yeah.
been suffering from the same
That's
thing
right.
they were or similar.
That's
Yeah.
right. So this last fall we opened up a telephone-based peer support line that so far has had just under 300 calls to date, which is just absolutely fantastic. There's no referral required, and people can just self-refer. Again, that'll be one of the numbers that we have available at the end of the podcast, right? And
Patrick Daigle will be happy to hear that because we did a
great.
podcast with Patrick. He was saying he didn't see enough people calling, so
Yeah.
that's really good news to hear.
Yeah, that's great. So, being able to connect with someone who's been where you're at and who can relate with empathy can really build confidence and hope. It can really help those people who aren't even sure, to kind of figure things out. Maybe they'll have a conversation with that peer support person who'll say, look, maybe you should, call the, there's a gambling, support service, or maybe check out the Mental Health Addictions website for some of the resources that are there. We even have, programs that are there for people who are interested in working on their addiction.
If you need
tranquility.
a volunteer, I'd be happy to.
Great.
If you need a couple hours a
great.
month or whatever, guys.
That's right.
That's
Okay.
That whole thing is fantastic, Dr. Sam. I'm excited to hear about it. I hope you don't mind my excitement,
Yeah.
but this is a wonderful idea.
So one of our pieces of work that Minister Comer has tasked us with doing is to find a way to really provide support to a host of community-based organizations who are really part of the mental health care system.
Amazing,
right?
eh?
And really bringing them into that system. Again, thinking about that idea of a continuum, right? That often these organizations are providing all sorts of supports with peers and other, social workers and other folks in the caring professions for those who are living with mental health and addiction challenges, who don't necessarily need the formal system, sometimes don't feel safe enough to go there, or sometimes they are getting care from psychiatrists and other psychologists and therapists. But this is also really helpful for them. So work is underway to really come to understand what all the needs are in different communities, like our work down in the Tri-County area, really coming to recognize they have particular needs, compared to when we went to New Glasgow. What are the needs there? What are the needs in Truro?
One
what are the
size
needs
doesn't
in
fit
Sydney?
all.
That's right.
Yeah,
but
that's a great
then
idea.
really looking at what are the local community organizations that are working there that really are doing high quality work. What can we do to support them and really have them be part of the system instead of feeling like they're almost working sometimes in opposition to the health system? And so that's part of the vision that really Minister Comer and others have really presented to us, is this opportunity to really say this: we're all in this together, right? Just
That's
the
the
way
key.
that we were in the pandemic.
But
I-
even more,
yeah.
and I'm not to interrupt.
No, please.
But I find with
I get
you two
excited.
I love it because you're giving good information what's happening. But
Brian knows this. He knows I go on and on and on. He's like, his eyes are glazing over.
The only
Yeah.
point I was going to make with you is that it's so nice to hear from my standpoint, somebody who's like, I love what I'm doing. Okay, I got to be honest, just helping people. I've had some people come to me and got help already, and the information is so important. But you two gentlemen are so compassionate, and you're so into helping people that and you're highlighting the good work that your government's doing and things. I'm just so glad that you came on, because this is the kind of people I want to have on here, so people know that addiction is beatable. You can do this. You can make this. You make yourself better. Your life can be better. You can help your family. You can help yourself. And I'm sitting here as proof of that. So for me, people like you will get that information out to people that really need it. That's the best thing I could ask for. So thank you so much for coming on. It's been amazing.
Yeah, Minister, when you think about folks that you've worked with, like who are living with addiction, right, in your work as a nurse, and talking with clinicians, right, what's your sense of hope when someone comes in and they have a devastating addiction, right, that they could get better? Have you seen that?
Yeah, I think probably two things come to mind. I think with that, I think we didn't really talk too much about youth, right, though, so far.
Oh,
so
yeah.
I think if you look at the impact that youth has, especially the pre-25, I guess you would say, period of your life. We all kind of know that's your most sensitive period to kind of develop significant addictions and mental health issues. So I think one thing that's a very positive step is that we're working very closely with education to actually
Fantastic
develop a
idea.
curriculum for addictions and mental health care in the public school system, right? To kind of
Fantastic.
talk about resilience, to talk about the impacts of trauma, because we know the vast majority of times trauma is often the root cause for addiction, like probably 95% of the time
Yeah.
in my clinical practice. Don't quote me on that. That's just
But
anecdotal.
you're going to be awfully close. No
But
question.
oftentimes it's a significant factor in the addiction, right? So I think having the curriculum in the school system for our children will help future generations for sure. There's still quite a significant amount of stigma, I would say, with addictions whether it's alcohol or opiates or cocaine or whatever the issue is. We live in a time now, unfortunately, where usually it's a polydrug situation too, so it makes things a bit more
What do you
complicated.
mean by polydrug, if you wouldn't mind me asking?
Well, I think oftentimes people could be taking, whether it's a host of prescription medications with alcohol or if it's
Okay. Crossover situations.
Yeah, so your treatment, it puts the addiction specialist in a difficult situation because it's a very complex treatment modality to get that person feeling better. So oftentimes that's where kind of our inpatient management can kind of play, I think, a valuable factor.
Yeah.
Just talking a little bit about the mental wellness side of things too, I guess, a little bit more of a positive note. I think if you look at things like your sleep, your nutrition, your alcohol use, right? Like these are things I think about even for myself and my own family,
Sure.
right? So, like we all have a role to play in our own mental wellness. I think with today's society, oftentimes the level of stress and the cortisol is often going 24/7, right? With busy careers.
My son's my cheerleader, and he's helped me with so much. I've lost 79 pounds. I've been on keto for the last 11 months.
It's fantastic.
But he's got me going to the gym and doing things, doing extra lap. So I think the biggest thing is motivation is so important in anything you do. And if you have people that you can do things because that is right to do, it makes you motivated to do more and more and more. And what you gentlemen are doing, the programs you're talking about, there is a positive. Everybody's so negative right now because of the world the way it is. But we've been through this. I went through 1979. I know how bad things can be, but they get better. And I think if we can get people to realize there's a positivity out there right now that after the pandemic we survived, that we're here, guys. Let's go turn this world into a better place. That's what I see happening. And gentlemen like yourself and your governments, you're doing it. I'm taking my hat off to you.
I think it's really easy to focus on the negative, and humans are really hardwired, right, to sort of analyze themselves, look for their faults and problems, and improve. Right, our whole democratic system is designed right for us to sort of make sure that we're able to criticize, able to sort of say, hey, that program isn't working. This isn't right. This isn't good. It's really important. We need to address the problems, and I think the pandemic was a great opportunity for people to sort of recognize that, hey, like like we're all suffering here,
Yeah.
And actually, compared to like say 10, 20 years ago, I think that there was a lot more, it was a lot easier for people to, even for the press, mainstream press, to talk about, the impacts on our mental health, right? It was just sort of given that was important. I think that, there's been a lot less stigma in terms of talking about mental health.
100%. Agreed. Yeah.
What we're working towards is to now give people the power and the tools they need to be well. Sometimes it's as simple as being reminded of the basic things that all of us can do to maintain our physical and mental well-being, such as getting enough sleep and making sure that we're getting exercise and curbing or limiting our alcohol use, for example. A lot of what's really good for our mental health is for us to be connected, for us to be together with each other, right?
And a positive attitude is so important. You're right.
That's right. And I think the pandemic taught us that too, right? If Dr. Strang's approach to talking to the public about the pandemic was to say, look, it's not about individuals. We have to care for each other.
Exactly.
And really, that's the way forward in terms of really mentally healthy Nova Scotia. It's a Nova Scotia where it's okay to talk about our mental health. It's
you
also
just said the most important part just now. That's us working together.
Yeah, that's right.
Yeah, no, you're right.
Yeah, resilient communities.
Yeah.
And resilient communities mean people know each other, they trust each other, and they really are motivated to support each other. And when we're struggling with our motivation, sometimes being with someone else who's encouraging us or caring for us, saying, yeah, I know it's hard, right? Commiserating with us, that really helps us with our motivation much more than even just like doing everything solely on our own, right? It's not up to even individuals, it's up to us to really sort of think about those around us in our community. Of course, everyone's tired and exhausted and so on. But I will tell you, even as a healthcare practitioner, and I've been working in mental health and addictions as a physician for 16 years, and I've been doing addiction work for about 10. And when I first started the work, it was intimidating, and I thought, oh, this is going to be exhausting. And what I found is that I've been really energized by it because of the colleagues I work with, the community of practitioners that has grown over time, but more importantly, the profound transformation I've seen in people living with addiction. It's absolutely inspiring, the resilience and the strength and what's inside of people who, when you first meet them, when they're in the throes of addiction, everything just seems like it's fallen apart, and you don't see any. It's hard to see the resilience and strength within that person, but it's in there. And when people tap into that, it's incredible what people can do. It's humbling every day. And I did my Wednesday evening clinic last night. I was there till about 9:15 at night after working at the government all day, and I was more energized at the end of the day than when I started. Jody knows that. I was texting her at 10 o'clock at night last night, our communications person who's sitting in the booth with us. So I think it's really important to know that part of the solution, even for our exhausted workforce, is to really tap into what's meaningful to you about this work, right?
Exactly.
What supports you in your work as a caring healthcare professional as much as possible, right?
Well, a lot of people at work say to me, why are you always so happy? You seem like such a happy person. I said, well, I get up in the morning, everybody has problems, but I choose to be happy. And I think we all have that choice. And I think there's going to be negativity in life, there's going to be problems, but if you can approach things in a positive way, and that's what I want the show to be, is that, listen, you can beat this. And it's not just about gambling, drugs, this and that. There's food addiction, there's so many different addiction problems that people aren't aware of. And I think the biggest thing is once we start to identify, and the pandemic really highlighted that, people were sitting at home, food was coming to them, they weren't exercising, all these things happen. And I think we're starting to break out of that now. People, the endorphins are flowing now because they're out working out and doing what they have to do. So I think that's the key to this whole process is basically for you gentlemen to come on and explain what you do.
Yeah, well, thank you for having us on today. I think we have to close things off here shortly. But,
No problem.
Appreciate everything you're doing for sure to get the message out and speaking about your lived experience. I think we've done a lot so far as a government, for sure, and there's definitely a lot that has to be done. And we recognize that, and we're dedicated to doing the work that has to be done. And I do think Nova Scotians will see that in the coming months and a couple of years of our mandate. So we would certainly be open, I'm sure, to coming on in the future.
I appreciate that, gentlemen. Thank you so much.
I'd just like to thank you for the time.
Well, one more thing for you guys. I was going to say this. Dr. Sam, everybody I've talked to in this field, love you. I got a special shout out to a gentleman named Steve DeVoe. He's with 7 Step Society, and Peter Brown. They've done some wonderful work for us, and we've been involved.
Great.
So I just wanted to just give them a little shout out if you don't mind. But thank you so much, gentlemen, for coming on the show, and let's hope that people get help from this and we get a call. And I'll get all your numbers from your team, and then we'll put this on the end of the show.
All right.
Thank you again for coming.
Thank you.
Thanks so much.